Good morning, students. Today let me explain about the last topic of this dairy farming chapter, that is superovulation and embryo transfer technique. Introduction. Embryo transfer is the process by which an embryo is collected or flushed from one female, that is the donor, and transferred to another female, that is the recipient, to complete the gestation period. The art of bovine embryo transfer is an overchanging science that involves three major events. It begins with the selection, superovulation, and artificial insemination of the donor animal. Next, the embryos are recovered from the donor through either surgical or non-surgical means, evaluated, and then frozen or transferred fresh. Lastly, the recipient animals are synchronized and receive the embryos through surgical or non-surgical techniques. History. The first successful embryo transfer was performed in 1890 using rabbit embryos. The first bovine embryo was recovered by Hartman, Lewis, Miller and SOET in 1930 at the Carnegie Laboratory of Embryology in Baltimore. In the 1950s, embryo transfer technology in cattle expanded with the first successful transfer performed by Umberg and the first calf born through a joint effort by the USDA and the University of Wisconsin. Until 1970s, progress was slow, with many ideas ending in failure. As non-surgical methods advanced, through the efforts of Elsden, Hasler, Seidel, and others, the commercial use of embryo transfer exploded. In 2002, over 25,000 ET cows were registered in the United States alone. Embryo transfer in cattle. The reproductive potential of each normal newborn calf is enormous. There are an estimated 150,000 potential eggs or ova in the female and countless billions of sperms produced by each male. By natural breeding, only a fraction of the reproductive potential of an outstanding individual could be realized. The average herd bull will sire 15 to 50 calves per year, and the average cow will have one calf per year. With artificial insemination, it is possible to exploit the vast number of sperm produced by a genetically superior bull. However, the reproductive potential of the female has been largely unutilized, and she will produce an average of 8 to 10 calves in her entire lifetime under normal management programs. Like artificial insemination has done for the bull, embryo transfer is a technique that can greatly increase the number of offspring that a genetically important cow can produce. Each of these offspring would potentially carry the superior traits of the mother, such as increased weight gain, increased size, or even increased milk production also. Embryo transfer also eliminates the stress of parturition on a desirable animal, thereby increasing her reproductive lifespan. Disease control, salvage of reproductive function, and potential twinning are a few of the other benefits of embryo transfer. Selecting a donor. Selection of a proper donor is essential to the success of the embryo transfer program. A potential donor cow can be selected based on the following criteria: possesses superior traits desired in the herd, must be at least 15 months of age, and has regular normal estrus cycles, and has not had greater than 2 services per conception, has not had previous conformational parturition or reproductive problems, and it must be disease-free. Superovulation. Superovulation occurs when supplemental hormones are given to stimulate the production of eggs. Instead of producing a single egg during estrus, the animal will produce many, that is 5 to 7 eggs during estrus. Superovulation treatments often utilize 5 to 6 mg of follicle stimulating hormone, that is FSH, given twice a day for 4 days. This dosage is gradually decreased each day. For example, 6 mg in the AM and PM, that is day 1, then 4 mg AM and PM day 2, and 2 mg AM and PM day 3, and 2 mg AM. Then administer a dose of prostaglandin in PM day 4. This results in ovulation approximately 48 hours after the prostaglandin administration. In superovulated animals, the ova are released over a 6 to 12 hours period. Therefore, the cow can be inseminated 2 to 3 times at 12-hour intervals and 12 hours after the onset of standing heat. Most cows will produce 5 to 7 viable embryos, while others may produce very low numbers of embryos. Heat detection. Great attention should be placed on heat detection, semen selection, and proper semen handling. Proper heat detection involves the following areas for consideration and attention in determining approaching estrus. Donor strands and allows another cow to mount her. Restlessness is seen. Decreased milk production. Off feed, that is reduced intake of food, or completely stop. Clear mucoid vaginal discharge. Donor animal or animals should not be left alone. A group of approximately 10 other animals is sufficient. Pens used should not be slippery or too crowded, that is for collection of these embryos. Recipient cows. So finally, recipient cows must be selected, and recipient cows serve as surrogate or foster mothers to the calves but contribute no genetic information. That means it just carry the embryo of a donor cow. For this reason, the genetic makeup of the recipient cow is not as important as the makeup of the donor cow. However, the recipient cow must be able to maintain her pregnancy to term and produce an adequate milk supply for her calf. Synchronizing the estrus cycle. Once the donor and recipient cows have been selected, they must be synchronized so they are on the same phase of their estrus cycle. So this is very essential. And it is important to synchronize estrus cycles because the reproductive environments of the donor and the recipients must be identical in order for the embryo to survive the transfer. The estrus cycle is controlled by the production and secretion of hormones at the proper time during the cycle. Prostaglandin, that is PGF2 alpha, is the hormone used to synchronize the estrus cycles of the donor and recipient cows. Prostaglandin is produced naturally by the cow. However, a synthetic version called Lutalize is given in 1 or 2 injections to synchronize estrus cycle. Preparing the donor cow to be flushed. Before the donor cow is flushed, she is superovulated with a series of injections of FSH, and ovulation is a process of releasing of eggs. So superovulation causes the ovary, that is the female reproductive organ, to produce many ova or follicles at a time. Preparing the cow to be flushed out. Continuation. And follicles are smaller blister-like structures that develop on the ovary containing 1 egg each. When the follicles ovulate, the eggs are released. Superovulation ensures that many eggs will be released because there are many follicles are present in the donor cow. Flesh. Once the donor cow has been bred, the embryos are allowed to grow for 6 days. During this time, the embryos also travels down the reproductive tract from the oviduct, that is the site of fertilization, to the uterus where they can be flushed out. On the 7th day, the embryos are ready to be removed, and this process is called flushing. Embryo professionals use a non-surgical method to remove the embryos, and the process requires experience and a patient, steady hand. So in this slide on the bottom, you will observe a person is doing this flushing of embryos from the donor cow. An injection of lidocaine is given prior to the flush to reduce pressure and stress on the donor cow and to make the flush easier for the ET professional. To begin the flush, a catheter, as it is shown in the diagram, is passed through the cervix into the uterine horn. So uterine horn means the bent portion of the uterus which leads to the ovaries. The catheter contains a balloon and that is inflated with a saline solution in order to seal the entrance to the uterus so fluid and embryos are not lost. So it is shown in the picture here. Removing the embryos. The uterine horn is filled with flush media and massaged to allow the embryos to flow out of the tract. So in the picture you observe that one person is holding the device and other person is operating, and this process is repeated several times in each uterine horn. Collecting the embryos. Embryos are carried out of the reproductive tract through plastic tubes and collected in a filter with the flush media. The pores in the filter are smaller than the embryos, so excess fluid drains out of the filter without losing the embryos. Injecting penicillin. After the embryos have been flushed out, uterus is injected with penicillin to kill any missed embryos or to avoid further infections. So it is shown in the picture that this penicillin is the one which is being injected in order to kill the missed embryos and to avoid infections. So transferring the embryos. The embryo to be transferred is put into a small plastic straw as it is shown in the diagram and then loaded into an embryo transfer gun. The embryo is then inserted into either the left or right uterine horn depending upon which ovary has a corpus luteum. So that is ascertained by some tests here. The CL, that is corpus luteum, is a structure on the ovary that secretes the hormone progesterone which is needed to maintain the pregnancy. So transferring the embryos immediately or it can be freezed also. So embryo should be transferred as soon as possible after the flush, that is within 8 hours at least, or the embryos can also be frozen for later implantation and stored in liquid nitrogen tanks as it is shown in the diagram, and such tanks can be easily carried from one part to the another part or even from one country to another country also. Embryo recovery. The non-surgical method for recovery of bovine embryos begins on day 7 after the onset of estrus. Embryos produced before day 6 are usually found in the oviduct and therefore would require surgical removal. That is why, in order to avoid that surgical removal, it is normally operated on the 7th day after the onset of estrus. The benefits of this procedure when compared to surgical techniques include fewer adhesions, the ability to perform the procedure under field conditions is less expensive, and fewer anesthetic risks. The embryos collected can then either be frozen or directly transferred fresh. So, transfer of bovine embryos. A common technique uses a AI gun, that is artificial insemination gun, and either a 0.5 or 0.25 ml French straw. So the French straw I have already shown you in the previous class. With this procedure, each embryo is loaded into a straw, the cow is cleaned, and the embryo is slowly deposited in the uterine horn. So here is the reproductive anatomy of the female cow. So as you see here, this is what the ovary, and this is what the body of the uterus and uterine horn, as I told you already, and this is what the oviduct, and this is what infundibulum, and the bladder, that is urinary bladder. So this is what cervix, and this is what urethral opening, suburethral opening, or the diverticulum, vulva, clitoris, and this is what the vestibule and the vagina. So these are the different important regions of the female reproductive system, that is in case of cattle. Benefits of embryo transfer. Traditionally, cows produce only one calf per year. ET allows the production of many offsprings within a year from a single cow. So instead of having only one calf, we can have multiple cows here. ET can increase the genetic potential of a herd in a relatively short period of time. And ET can increase milk production in dairy herds also. And ET can increase weaning weights in beef and dairy herds. ET allows other producers to take advantage of superior genetics because frozen embryos can be shipped almost anywhere. And ET preserves superior genetics for future generations due to embryo freezing. So these are some equipments that are required for this technique. One is plastic media bag and Foley catheter, that is to insert the embryos, and embryos filter, and then microscope to observe the embryo, and straw, that is French straw, which is used to transfer the embryo, and this is what the rod which pushes that French straw deep into the uterine horn region. So these are some other equipments that are necessary for embryo transfer technique. So as it is shown here, one bottle, that is FSH, this is the follicle stimulating hormone, and prostaglandin, the function of which I already told you, and the transfer of this embryo requires some other chemicals too, that is the penicillin, that is to avoid infections and to kill the existing embryos after flushing is done. And this is what lidocaine, which is also very essential here for this technique. So these are the details of this multiple ovulation and embryo transfer technique. So with this, I have completed this dairy chapter. Thank you.